Um, I'm Lawrence Yang, as you guys know, and with me today is Hussein Kanji. Hussein and I are the provincial alumni leads for the PQI alumni. Us and the Synergy Hub alumni regional champions, the Sharks. We're really excited about the concept of Synergy Hub, but we haven't really shared it with anybody before. So I thought today we'd have a convo about that, Hussein. How are you doing? How much did you sleep in the past 24 hours?
It's not it's in the order of minutes, but Lawrence is great at twisting my arm to do these do just about anything. So how can you say no to this guy? Come on, I'm here.
I really appreciate it. I know how hard you work in the intensive care unit. We all really appreciate everything you do, especially during the pandemic. Um, what is this Synergy Hub thing, anyways? Like, who's allowed to be in it? What is it?
Oh, you know what it is? It's great. The best part is I get to work with this guy to create a network, and we're tired of networks and groups and people. We want to honestly, we want to bring people together. I get excited about QI. I get excited about being around people who are loving QI, and so what better way than to come together in a synergy hub, to come together to actually build something better. Isn't that what synergy is? I don't know. Lawrence, tell me, what's synergy?
Yeah, I think it's where two people, maybe with different skills and different lived experience, come together and find that together they can build something way better than they could have built alone. And we're building a system here. Our system needs redesign, like right now, yesterday, years ago. And those of us who've gone through the PQI training or any QI training, quality improvement training, we have a methodology on how to improve systems and improve processes. Um, but we didn't really have a provincial space to share our knowledge or collaborate, share what we're working on, what we're excited about. Um, share our why, share our story of why we're doing all this work. So that's what excites me about Synergy Hub. Now, is Synergy Hub a specific, like, is this a, what is it, where, how do people get into the Synergy Hub?
It's funny, actually. He's asking me a question. I'm going to quote him. He calls it agnostic, and you say it all the time, but it's based on the vision of what it is, what you said, right? Like coming together and doing, like, there is, we want to create a platform, yet we don't want a platform. We want people to come together. And I actually was reflecting back on what you just said, which is, why does this not exist? Why are we doing everything in silos? Why have we not done this before? Everyone, you know, we're powerful in numbers, we're powerful with energy, we're powerful together. I'm going to repeat myself because that's the way I feel. If we come together and we do this, it's going to be, I think there's so much we could collectively do. And if we all come together, when we have our huddle events and our other CME events, like, gosh, anytime we connect with these people, you tell me how it feels.
Yeah, it's
Where's the power? There's power behind this, and I think we can honestly make some real change together.
Yeah, I agree. It's awesome when patients, patient voices, patient partners join us, and we have PQI staff members who are really passionate. We have members of the Legislative Assembly on our WhatsApp group, and yeah, I think it's a place that's really inclusive. I think anybody can join us in the Synergy Hub. You just have to be excited about improvement, right? We call it QI enthusiasts, right? So I, it excites me too. In your work, I know that you've done a lot of work with teams around improvement, and Synergy Hub is like the team of teams. I see it as a team of teams. Um, when when I say when I say Synergy Hub, what are some of the images that come to mind for you?
To me, honestly, it's like again, I chatted with you about this previously. It's actually the guy. We have so many people interested in doing this that don't know where to go and what to do. We have the enthusiasts; they're always enthusiasts. Let's bring everyone together and collectively, like, let's move the system forward. That to me is what we've been so siloed in healthcare, especially in this province, that I have no clue. We shouldn't be siloed in health improvement. It disturbs me, it bothers me, and I feel like if we all come together and collectively share our learnings, come together. To me, that synergy hub, like, we can make some real change. Again, I'm going to be a broken record, but what,
Uh,
I'm gonna flip it. I'm gonna ask you the same question. What do you think?
I agree. You know what you just said there, that everybody's trying to work and do things in their silos, but they're not really sharing, getting a chance to share and showcase their work. And then so people are reinventing the wheel all over the province. And we have communities of practice around clinical areas. We have people who are training in leading teams and leading teams in a different way. And there's so much that we could share together so that we don't have to keep reinventing the wheel. And I think that's what comes to mind when I think of Synergy Hub, a place of sharing, of democratic, distributed leadership, and really excitement around the triple aim, or they call it the quintuple aim now, when you add in the equity lens and you also add in the health professional wellness. So yeah, that's what really gets me excited. A whole group really caring about kind of the same things, but working on different portions of it, kind of like a hive mind of improvement. That excites me. I love that you came up with the name Synergy Hub, and I can't wait to see where this is going. Like, where do you think the Synergy Hub might be in, let's say, 5, 10 years from now?
Gosh, you talk and I listen and I'm in awe. You said hive mind. Is that what you said? I love it. You just it's fantastic. You come up with these things on the fly and it's just amazing. And you know what I want? I actually I'm going to reflect on like a fantastic project during my training of ED wait times for radiology, right? Like incredible things that are happening again in microcosms or silos. I would hope that we continue to share and we continue to grow. And with that energy, it propels into something bigger, right? You can have one project. In 5, 10 years, this will be something that we all collectively do. But what I want, and you know this, I've talked to you about this, is I want to change our vision of QI in this province, our understanding, our honestly, I think we're behind the times, right, in BC. So I feel like we need to catch up, and this is part of it. And we'll realize that through these kinds of efforts, this is where real change will happen. And what you mentioning, and Lawrence, I'll reference you, is patient centric. I've been humbled, and I think we always need to go back and think about patient centric interventions and QI. And I've been humbled through my learning. I'm still learning, and I don't know. That's it for me. What do you think?
No, I agree with you. I think the Synergy Hub can be a place where patients are really involved, and not tokenistically involved, but like authentically involved in guiding improvements into the system that they and the whole community fund. Yeah, so as you said, like reducing wait times in the ER. Sometimes we look at those types of problems and we just see a big, great brick wall that we can't change anything about it. But if we actually invest time, resources, talent, money, and patient partners, people with diverse perspectives, even engineers or process improvement people, we could do a lot. And then we spread that throughout a network. Like you said, we could achieve changes that we haven't seen before. And what we're talking about is the frontline driven improvements, and where everybody cares about the triple aim again, which is resource stewardship, community wellness, and improved health outcomes. Like, if imagine having people who really care about the resource expenditures making the changes. It, we have so much waste in our system, and it would get us a really long way towards a more sustainable health system. Yeah, Synergy Hub's exciting me. I want to thank you for your time. Do you have anything else you'd like to share with the audience today?
Gosh, I don't know. When I think of QI enthusiasts, that's what you said. I think about people who truly care, people who truly have their heart in the game, who really, really, really earnestly want to make a difference, and that's what excites me, and that I hope will be the ethos of Synergy Hub.
Yeah, yeah. Hey, thanks, brother. It's an honor to work with you, and I'm sure we're going to do this again. Bye for
Uh,
now.